Thank you, Chairman Wenstrup, for holding today's hearing. And thank you for the witnesses. Thank you for offering your time, your expertise, and your testimony before this committee. Today's hearing, entitled Because I Said So, examining the science and impact of COVID-19 vaccine mandates, could not be any more fitting, especially since it was the government who demanded that individuals get the vaccine or else. Even worse, it wasn't an empty threat. People lost their jobs, our children's education and growth was stifled, and our military and healthcare workers were terminated simply because they refused a government-mandated vaccination. That's what we're examining, that's what we're talking about today, the mandate component of it. There is a line between providing information, recommendations, and administering vaccinations to those who choose so. And the other side of the line is a forcible and coercive blanket mandate that the federal government imposed during a pandemic that many Americans were forced into losing their jobs. This committee has continued to expose the flaws and neglect that took place during the pandemic. It has been our responsibility to ask the difficult questions, questions that deserve answers. It's clear that the American people's trust in public officials has been harmed by failed policies and flawed mandates. Dr. Bardosh, in your paper, you mentioned that political leaders singled out the unvaccinated and blamed them for the continuation of the pandemic. In fact, in July 2021, during the onset of the Delta variant wave, CDC Director Rochelle Walensky said that it was, and I'm quoting, becoming a pandemic of the unvaccinated. Is this the sort of blame, Dr. Bardosh, that you were referring to in your paper?
Yes, it's a scapegoating response.
Dr. Bardosh, I'm going to make this simpler. Do you believe that this sort of language is harmful when we look for public officials in charge to scapegoat?
I think, the HIV/AIDS community has done a lot of research on stigma and scapegoating, right? And, decades of research has shown that stigma as a public health strategy is counterproductive. I'll leave it at that.
Dr. Bardosh, let's amplify some of the points from your publications. There was a collaborative effort that you published with researchers and physicians from Johns Hopkins, Harvard, and Oxford. Yes or no?
Yes.
Did the COVID vaccine mandates from your research, from your publication with others, erode civil liberties?
Yes, it did.
Did the COVID vaccine mandates fracture trust in public health officials?
Yes, it did.
Did the COVID vaccine mandates create financial stress to individuals and families who lost their jobs to the COVID mandates?
Absolutely.
And Dr. Bardosh, do you feel that the decrease in individuals receiving routine pediatric immunizations for their children, do you feel that is due to the mandates of the COVID vaccine?
Yes, I do.
And finally, and I thank you for your brevity, Dr. Bardosh, do you feel that the COVID-19 vaccine mandates have harmed America?
Yes, I do.
I think the message that you conveyed to this committee is important. We have looked and discussed origins, we have looked and discussed impact, and that is what the obligation of this select subcommittee is. It is our obligation to understand the COVID-19 vaccine, its effect on mandates. I thank each and every one of you for your testimony today, and Chairman Wenstrup, I yield back.